up on just about a year. We have been visiting with officials from the county of Imperial, and we've been getting information and updates on the COVID-19 pandemic. And with us on the phone, socially distancing, Imperial County Public Health Department Director Janette Angulo. Good morning, Janette.
Good morning, Carroll. How are you? I
am well. It's another beautiful day in the valley, right?
Beautiful day it is, yes.
Okay, which kind of brings up an issue, and we just heard, supplies of vaccines have, they've kind of really slowed down because they're not having beautiful weather back in the Midwest and in the East. So has that impacted us here in the Valley?
It has. It has impacted. We're waiting on 1,500 doses that haven't arrived. They were supposed to arrive earlier in the week. We're talking about 1,000 first doses and 500 second doses. So it has impacted us here in the Valley.
Okay, so as we were aware, no mass vaccination clinics this week, which means you may be able to double up next week?
Well, no mass vaccination this week. What may be happening next week is that some local providers may be receiving doses at their offices. And as far as the allocation, that information came a day or two ago. We're getting 3,770 allocated for us next week. Hopefully there are no shipping delays and we do get it on time. We usually get shipments Tuesdays or Wednesdays.
Okay, one question that I've had in the back of my mind. Does the vaccine come through the Imperial County Health Department, or do other healthcare providers through other channels?
So the applications are presented to the local health department, and we work with our local vaccine ad hoc group, and then we look at those providers that are enrolled. They have to be enrolled in the state vaccination program. And if enrolled, then we may redistribute vaccine from whatever's in inventory at the health department, or if the order is placed, then the distributor will directly to the provider offices. So it could be either or.
Okay. And just as kind of a side note, I pretty much consider Kalamazoo, Michigan home, and Pfizer is headquartered in Portage, which is actually a suburb of Kalamazoo. And President Biden in Portage today, I think he's got a whip and a chair and trying to speed up production of the vaccine. But, we're kind of at the mercy of the suppliers, the manufacturers, the feds who are distributing it down to the state level, and then the state level that's distributing it to the local level, right?
That is correct. And, ever since the distribution of vaccines started by the state of California, in Imperial County, we've received a box at a time of Pfizer vaccine. So each box contains 975 doses. But very recently, there was a change. So that now the box will say it contains 1,170 doses because we are able to pull a sixth dose from each vial. So again, we've been receiving just one box of the Pfizer vaccine ever since, and that's per week usually, since the distribution started mid-December.
Okay, and that's why the rollout is, so get a kick out of, I'm not going to pick on the governor, but touting all these mass vaccination clinics, and they're not vaccinating anybody because, we opened Petco Park, we opened Dodger Stadium, we opened this site. Oh, by the way, they're open for mass vaccinations, but there's no vaccine, so there's no... the clinic isn't operating. But, I think that's part of the politics that are involved.
Well, let me tell you about our clinics in Imperial County. Well, you have medical provider offices. When there's supply, then they have clinics on site, on their provider office site. But as far as the public health department, we've done so far since mid-December 18 travel clinics. So the public health department, picks up their supplies, they pop up, and we did this more for the EMS and the fire providers, the firefighters. We would get our stuff, we would go to them, we would pop up, our clinic, and we would immunize emergency first responders. We've also had 28 curbside clinics, and that's on our parking lot. And we can see close to 300 people a day through our curbside clinic. So we've had 28 curbside clinics. We've had one mid-sized clinic where, we call mid-sized clinics anywhere, if we see 500 to 700 people. We've had one of those also in our parking lot, and then the 2 mass joint vaccination clinics. So slowly but surely, we're getting the vaccine, out as soon as it gets here. But again, the rollout has been a little slow.
Okay, some of the questions that we get, and I'm sure you get them as well. Okay, you get the first dose, the second dose is to follow. What's the procedure? Once you get the first dose, how do they set up the second shot?
Yes. So through the health department, we're using the state system, the electronic appointment system. So what we do is once an individual gets their first appointment, there's an email address. We will send information automatically to those individuals when the second clinic is set up. Now, yes, there's 21 days for the Pfizer and 28 days recommended for the Moderna vaccine. But it could be up to 42 days after you receive, the shot. So if you get it within the 6 weeks, you're okay. That's the CDC recommendation.
Okay. Now, one of the things that came out earlier in the week, Dr. Fauci, I believe, said, okay, with the mutations and the variants of the virus, you may need a third shot. Is there any information coming down on that?
Well, we're still waiting on information. There's still studies that are being done. At this point in time, we don't have any further information from the state of California, so we'll keep an eye out for that information.
Okay. And speaking of the mutations, the variants, have they popped up in Imperial County yet?
You know what? I don't have that information. I know it's popped up in the state of California, but I'll get back to you, Carol, on that specific question.
Okay. And some people concerned, what are the side effects? Are you implanting a microchip and going to control my mind? Have there been any significant side effects reported in Imperial County?
Well, no, not at this time. No significant side effects. A lot of the side effects are, the soreness in the arm, feverish. But that's fine. That's part of some of the side effects of not just the COVID vaccine, but of many, many other vaccines that are administered. So once an individual gets the COVID vaccine, that is why we have that 15 to 30 minute observation period. So if there is any side effect whatsoever, we can tend to the individual right away. And so that's what we've been doing. We've been partnering up with our paramedics, our firefighters at these, events. So if there's any reaction whatsoever, the individual can get immediate attention. But as far as our clinics, nothing major, Carol, has been reported.
Okay. And, keeping in that same vein, the vaccines, yes, they were developed relatively quickly, but they seem to be effective. And trending downward, the number of active cases right now is so much less than it was just even 60 days ago. That's not so much the vaccine in my mind, because there hasn't been, out of 190,000 people in Imperial County, people are still sticking with the covering their face and maintaining social distancing and being smart, right?
That is right. We're seeing a downtrend. We're seeing a positive downtrend. So you're right, not as many active cases. When we take a look at the hospitalizations, the COVID-19 hospitalizations, I'll just give you an idea. The first week of January, we were close to 200 COVID-19 hospitalized patients. If you take a look at our statistics, yesterday we were at 30. That's a huge difference. So yes, and that's 30 COVID hospitalized patients between both hospitals.
Yeah.
And then the case rate has been, just going and dropping. We're at an 18.4 adjusted case rate, and we are still seeing a decrease in that. And as far as the testing positivity, we're actually in the red tier metric. We're at 7.5%. So working in the right direction.
Okay, and just waiting for approval from the state to maybe move forward with being able to do a little bit more.
And so for the case rate, like I said, we are looking at an 18.4 case rate. So in order to move into the red tier, we have to fall below 7 case rate, and the testing positivity has to fall, below 8%. And both have to be met at the same time, and we have to be in that metric for 2 weeks. So it's looking positive, Carroll.
Okay, looking positive, but it's not going to happen overnight.
It's not going to happen overnight. That's right.
Okay, testing still available. I know OptumServe site at the Veterans Hall in Imperial. And, one of the things we have been saying from the get-go is get tested. Get more people tested that come up negative. And that helps move us into the positive territory.
And so testing, yes, you bring up a really good point. We still have quite a bit of testing happening in Imperial County. We have the travel team that's stationed out at the Imperial Veterans Hall. We do have the Brawley site, and we do have the mobile unit. As soon as next week, that big bus may be downsized to a minibus, but we'll still have a mobile unit in Imperial County. And we have seen a lot less testing happening in Imperial County. And yes, we do encourage our community to keep on, getting tested, because that helps us at the Public Health Department, just keep an eye on the activity that's happening in Imperial County. It's for surveillance purposes. It's really helpful.
Okay. Just kind of in the same vein, but a little bit different topic. The regular flu. How has that impacted the Valley? The normal every year influenza.
Yes. So COVID-19 has been the prominent conversation. Flu, we are seeing the strains, but it's not as prominent as what we're seeing with COVID.
Okay. Is the step-down facility at IVC, is that still working?
That is still working. The alternate care site. You're talking about the alternate care site?
Yes.
Yes, it is. It is operating. There are not as many patients at the facility, but they're still receiving patients, yes.
Okay. And did we miss anything? Anything that you wanted to, the normal operations of the health department continue, and we're coming up very, very nearly a year during this pandemic. Everything else has been functioning?
Well, it's been functioning as good as it can function. A lot has been done remotely. But yes, there's a piece that I do want to mention, Carroll, and it's going back to vaccination. And the rollout has been slow, but even though it's been slow, we've been able to immunize over 25% over 65 and older. And we've also done quite a bit of vaccination for, the phase 1A, the healthcare workers. That's what it focused mostly on. We're starting to blend in a few other sectors, and that includes emergency services, the education and childcare, the food and agriculture. So, for example, within education, they have healthcare personnel. So we've been vaccinating the school's healthcare personnel. For emergency services, we're starting slow. We did start with law enforcement, and we're soon going to start with, childcare, the rest of the education sector, and the food and agriculture. So we're excited. We're going to ask for a lot of patience because we don't have the thousands and thousands of vaccines to work with. We're going to start small, but we will start soon.
Okay. And again, waiting on the vaccine, and that comes from the feds to the state and down to us.
That is correct.
Okay. Janette, you have a great weekend.
You too, Carroll. Thank you so much for having me.
Okay. Stay safe. Wear that mask and maintain social distancing, right?
You got it.
Okay. Thank you. Have a good weekend.
You too. Bye-bye.